This is the Rebound Tampa Bay podcast. I'm James Tully. Hey, full steam ahead right now on vaccine distribution in the United States and all over the world. As of this recording, Moderna and Pfizer both have received emergency use authorization by the FDA, and they are being handed out to mostly healthcare workers on the front lines right now. And several hospitals in the Bay Area, for example, have received doses to distribute. Now, maybe you've seen political figures publicly get the vaccine. But one of our reporters, Larissa Scott's been filing reports constantly about the latest on the vaccines and what the status is of them. She's my guest today on the pod. We're going to talk about all things that she's been reporting on, some of the doctors and scientists that she's spoken to, how it's changed her mind about the vaccine, and important things for viewers like you to know. Here's my conversation with Larissa. You can see her every morning on Good Morning Tampa Bay. Larissa Scott, one of our best reporters on the team. She is basically been churning out these stories about the vaccine here for the last couple of weeks. And Larissa, thanks so much for being on the Rebound Tampa Bay podcast to talk about it.
Yeah, happy to be here. Thanks for having me.
Yeah, happy to. You know, the thing is that you're the one who connected me with Dr. Jason Wilson at Tampa General Hospital. And he was on the Rebound podcast a couple of weeks ago and really took us all to school on the vaccine itself, how exactly it was developed. He called it a modern medical miracle, which is great to hear. I also feel like that's something that maybe has been pushed aside because of how desperate people are for the vaccine. They're so curious about distribution, who's going to get it, when they're going to get it, that we really haven't talked about just how amazing it is that it was developed in such a short time. And in Dr. Wilson's words, truly a modern medical miracle.
Yeah, no, it's been really interesting to see how it's all come together. And I've been really lucky to talk to a lot of scientists who've been a part of working on these big projects for the CDC and, doing COVID-19 projections and things like that. And that's kind of just how they all describe it, is that this is just, think of like the world's most brilliant minds coming together to get this out. Part of my reporting has been also talking about a lot of hesitancies that people have about getting this vaccine. And that's, one of the big worries that people in the healthcare industry have is that there aren't going to be enough people who decide to get vaccinated because they have some concerns. And of course, many of those concerns are really valid. But one of the biggest things that these experts are telling me that they're hearing that isn't necessarily true is that people say, I don't want to be a guinea pig, and so I think that we have to remember that, these vaccine phase 3 trials have had hundreds of thousands of participants a part of this. And you mentioned Dr. Wilson. The last time I spoke to him, he was saying how with Pfizer and Moderna, that there weren't any serious side effects in any of their trials. So I think that, if you're someone who's feeling uncomfortable with it, of course, do your own research, ask people who you can trust the right questions. But just remember that the FDA and the government and all these brilliant people in healthcare who are working to make sure our community is getting better wouldn't be behind this, supporting this, and getting this vaccine themselves if they really didn't believe that it is like the answer to helping us get back to a sense of normalcy again.
Yeah, well, that's really well put, Larissa. And, I wouldn't often ask somebody in your shoes how they personally feel about something, but has all of the work that you've done and all the scientists you've spoken to and the reports that you've presented on Good Morning Tampa Bay, has it quelled any fears you may have had about taking a vaccine? Has it changed your mind at all?
Yeah, definitely. I mean, I had those same concerns too about, hey, this has been really fast. And this has also been a topic that's been really politicized throughout this year. And, of course it makes people weary. Like who wouldn't be weary? Anyone who's been paying attention with what's going on. And just with COVID and everything, I think that we've all been a little on edge this year, understandably so. And I mean, even I have family members who work in the healthcare industry who've also had concerns. There's just a ton of misinformation out there and very valid concerns. But I have this great privilege of being able to talk to these people to help get this information out to the community. And I've even had personal conversations with them once the camera's not rolling anymore, just to ask them some of those questions too. And they have really made me feel comfortable and confident that this really could be the key here to help us move forward. So yeah, I mean, I'm just like anyone else who, I don't want to put something in my body if I think it's going to harm me. But I feel really confident in this vaccine that it could really help us.
Let's talk about it a little bit. So, really when I had my conversation with Dr. Wilson here a couple of weeks ago, and you can find that previous episode right here if you subscribe to the Rebound Tampa Bay podcast. I highly suggest you do, because it was vaccine 101, Larissa, is what it was. I mean, he basically gave me a class and a lesson on it. Now, I had known this a little bit, but there's no strain of the virus in the vaccine. Basically, it's giving you a printout of instructions for your body and your immune system to take on the COVID-19 virus itself. That's really important. I feel like that should be that's the lead. I think that's the lead when it comes to talking about the vaccine.
Agreed. Yeah. A lot of people are worried that this is a live vaccine.
Right.
And like you said, it just isn't, and I'm sure Dr. Wilson probably mentioned it too. He told me that, this technology has been around forever, right. The technology that they use to create this vaccine. So I think that should be another layer of comfort for people when they're considering getting it. And one of the most interesting things that I've learned throughout this process is just that we're going to have to continue wearing masks and practicing other social distancing measures for a while until we get enough of the population vaccinated. So, one of the things with, for example, the Pfizer vaccine that experts have told me is they don't know that it will prevent you from being contagious.
Yes.
They just know that it will prevent you from being symptomatic. So, let's say I got the vaccine, but you didn't, and I'm around you, I could still be carrying it, but I would be asymptomatic. So I think that's just also another important layer that people need to remember, that it's going to take a little while longer, but it should be a good next step for us.
We have heard a lot of promising things next year about late spring, early summer, starting to maybe be able to relax mandates and relax your social distancing just because enough people will be vaccinated. Something else that's promising, one to get your take on, today we reported how the airline industry, some resorts, other vacation destinations are reporting an influx of people booking trips. This is all promising. It could be false hope. I mean, we don't know. We can't just fast forward to that time to know where we're going to be. But it is kind of nice to start being able to report that type of news, that industries are saying, look, people really want to get back to normal, and they're booking things in anticipation that they're going to be vaccinated and be safe. It's good to hear. You just have to stay optimistic because we're not there quite yet.
Exactly. It's just, I think, for the first time, this huge glimmer of hope for us that
feels that way.
Hey, yeah, it really does. It's like, hey, sometime next year, we could maybe start seeing our family and friends again. We could maybe start booking trips again. I, like many other people, canceled everything this past year just to be really safe. And, it's been a strange year having to just really hunker down and, and keep your distance from people, which is so unusual for us to do. But I think that with the news of these vaccines, it just really is just so hopeful that now you feel like there's like an end in sight. Before there wasn't that. And so, yeah, but I think you mentioned a good thing. It's just like really important to note that we shouldn't like jump the gun and get ahead of ourselves here, because the vaccine, it's so close for us to be able to get vaccinated and for us to really reap those benefits. But before that happens, we still really need to be careful, because we don't want to ruin it and have this huge surge ahead of time with more people getting sick, hospitalized, and unfortunately what comes with that is more death.
Unfortunately, you are right about that. In the meantime, though, there are a lot of reasons to be optimistic after a long year. Just an example for anyone listening here, Larissa and I used to see each other every single day. I have not seen you in person, Larissa, since probably the middle of March, whenever the stations began and it's just very weird. I mean, I see you with your reports you send in every morning, but it's just been a very unusual way of working. And before we hit record here, Larissa, you and I were talking about how, look, we're getting it done. When you talk about specifically, our particular news program and what you contribute so much to, we're doing it, and we're blessed to be able to be doing it well. But I don't think there's anybody who wants to continue doing it the way we're doing it. This is out of necessity. So, we want to break out of this too, just as much as anybody else. And Tampa specifically has a lot of things to cross their fingers for. You've got the Super Bowl here coming up, and that's a big one. Gasparilla in some form is always a gathering of a lot of people too, Larissa. So in talking with some of these scientists and these doctors, how do you feel about how Tampa would move forward with something, these large scale events in some way, shape, or form here?
The Super Bowl, I would be surprised at this point if they would make any. They've come out with the safety changes that they've recently made.
Hmm.
I think it's so close to where we are now, 2 months away. I think that we'll probably stick with those changes that they've had. In terms of Gasparilla, I feel like based on the people who I've been speaking to, it's a lot harder to control people, and they're so making sure that they're social distancing and wearing a mask with the huge crowds that come and celebrate for Gasparilla. So honestly, I spoke to an expert last week who said, he would be surprised if they didn't push it back a little farther.
And I also heard the same thing. And I do know that the NFL they're not exactly being very open about this, but they do have like a 4-week window for the Super Bowl to push it back. That also could be if playoff games or whatever are canceled because of COVID infections or what have you. But there are built-in windows. Still, these aren't. I guess the sports commission and really the city of Tampa would be a lot happier if maybe these events were happening 4 or 5 months later than what they are. But it's kind of what we have right now, and either you press forward with restrictions or you hit pause and wait. That's kind of where we are with so many things here too.
Oh yeah, definitely. And I just think that we're finally kind of on the up and up. It's like it's on the horizon where, okay, maybe Gasparilla does get pushed back or the Super Bowl does get pushed back. But I think that the promise that it could still happen is really what's so hopeful.
Agreed. Amen to that. Larissa, a couple startling things. You want to talk about some things that have really shocked you and stunned you when you talk to these medical experts that have really opened your eyes to maybe what you thought this pandemic was, and maybe it's something entirely different, or the way that you perceived it. Anything like that that's really stuck out to you?
I mean, I think just hearing them talk about what it's been like in the COVID units, is just really eye-opening to hear. When you hear a firsthand experience about the long hours and people, not being able to say goodbye to their loved ones, unfortunately, when they pass, or just how much they really struggle, the people who have severe cases. I think it's just when you're so far removed from it and it doesn't affect you personally, you don't get it. But when you're looking into the eyes of someone, even if it's virtual, and you can tell them getting emotional just talking about all of their patients who are having such a hard time, I think that has been a really surprising aspect of it. And then also, unfortunately, talking to some doctors recently is that they're starting to see their COVID-19 units fill up again, and so I think that that's just another reminder that even though 2021 looks much more hopeful for us, we really need to be hunkering down right now, because they're starting to see the hospitalization numbers go back up. And it's just, really harrowing firsthand accounts and experiences when you hear about just how awful it really is in those units. And thankfully, a lot of us don't know what that's like. But, for our healthcare heroes and the people who they take care of, I mean, it just sounds really, really awful.
Yeah, when you put a face to anything, it brings it home. That really hits the emotional buttons. There's a litmus test I do every single day, and our station happens to be right next to Raymond James Stadium, and there is a testing site in the parking lots there. And it has been rather fascinating to see the number of cars that wait in line. I think the testing site opens at 9. And to see that shrink a bit before the holidays, and then grow again. And it's just a reminder that even if you feel like, the lights at the end of the tunnel here, there's proof right there that there's, hundreds of cars in line of people who think that they may have either been exposed or they're experiencing symptoms or whatever it is. And to see it grow again, it again drills it home to somebody like me leaving the office every day, and I see that line. Well, last week that line was really, really big. Coming here back home to my home studio to do this podcast with you, that line was really long this morning. Again, little things like that kind of drill it home, and you can see with your own 2 eyes.
Absolutely. And I would say another thing that's been really shocking is just hearing the data over the past several months about how effective masks are.
Right.
I had someone recently tell me that masks are the only medical device that we have that is relatively inexpensive, doesn't hurt you, and is so effective in keeping the virus at bay. So, I think at the beginning of this, there was a lot of confusion about should we wear masks, should we not wear masks, do they work, do they not work? I mean, I was one of those people who I remember I went to New York like the week before the city shut And my mom was trying to tell me to wear a mask. And I'm like, wait, no, the research says that I don't need to wear a mask, that you only wear a mask if you're sick, So there's been so much misinformation. But after all the research over the past couple months, just hearing the new statistics that recently came out about just how effective they are, I think has been really surprising too.
Agreed. I think there's a lot of things that have just been said to be said. And, you have to separate the fact from fiction. And again, this is why it's so important to have somebody like Dr. Wilson in, and all of your reports recently where you are citing him and you're using his info. That's really crucial, because there's a lot of things, again, that are being said just to be said. And I think it's that's a separation that absolutely must be made at a time like this.
Oh, absolutely. Something like this where it's, actually can be a life or death situation, and really, caring for your family and friends and keeping everyone safe. It's so important that people just get their information from reliable resources. And, like I said, there's just so much misinformation out there about this. So I'm glad that, our station allows us to, have someone like Dr. Wilson on a lot of times so that he can keep us updated with what's happening. He is the associate director of Tampa General Hospital's ER. So he's seeing this stuff all day firsthand. He has these COVID patients. And so he really, is kind of on the pulse of what's happening when it comes to COVID-19 in our community.
I couldn't agree more. We're lucky to have him. We're lucky to have you too, Larissa. Thank you so much for making a little bit of time. I'd always do this at the end. I'll give you the floor. If there's any messages upcoming, things you're looking to do to get answers to, please, by all means, take this time to share it with us.
Sure. One of the stories that I'm working on to hopefully get on there after the holidays is just doing just a whole series of stories about vaccine myths to just really answer people's questions, kind of, speak to what those myths are, where they come from, and just, talk about the truth of what's really behind that. And so I know that they have a lot of questions when it comes to the vaccines, and there will be a lot more questions, as we get closer to community vaccination. So that's one of the big things that I'm working on. And then just now, as we head into the holidays, just really want to remind people to just keep going. Like we're almost there, but just don't let your guards down just yet. Like the light is at the end of the tunnel. We can reach it. We just have to hunker down for a few more months.
Exactly. Be able to identify yourself or someone close to you as high risk, right? And in those cases, you need to be really, really careful around that person. Just because, you might be in your mid 30s and in perfect health, there's people that you could possibly be around that are fighting something, and this could be really detrimental to them. Dr. Wilson used this analogy. Wow, we should be paying him some kind of stipend for this. I mean, we're name dropping him about 50 times, but he's a great resource. He used this analogy, and it was perfect. And it was that, just think of your immune system as an army. And if you're able to send all of your troops to one spot, your chances of winning that battle are really, really high. But the chance, when you have to split up your troops and fight several battles, you run the risk of losing those or getting hurt pretty bad. And that's the idea with your immune system. So if you know somebody, or you yourself, your immune system's busy doing something else in your body, you're high risk. You have to be really careful. And it really is as simple as that.
Exactly that, and then that will lead me on my next thing that everyone keeps reminding me to, remind people about, is to get your flu vaccines.
Yep.
That's a big part of this too. And the good news is,
and we should say, with the flu vaccine, that's something health officials are really pushing for. I mean, we're not doing a commercial for flu vaccines here. I mean, this is something the health officials have said, listen, of all years, this one, it's very, very important to do that. To be able to at least eliminate some of those symptomatic people from the list of people thinking that they may have COVID-19, that alone. Yeah.
Yep, exactly that. And I was trying to get a flu vaccine this past weekend, actually, and they were all out, and I finally found a place. But that was good news to me, because that means that people are really listening and are wanting to be as safe as possible. So, that would be kind of the last thing that I have to say is like you said, every doctor who I've spoken to over the past couple of weeks is just asking us to remind people about how important it is for them to get their flu vaccine this year as well.
Very telling. Before you go, you mentioned vaccine myths. Any of them that are popping out to you right now that you've heard people bring up that you want to try and debunk or talk about?
The number one that I was talking about was, people being guinea pigs, going into the side effects that people can expect.
Sure.
And really, like, really diving into just how the vaccine works. There's still, we touched on it a little bit, a lot of thought that this is a live vaccine when it isn't. And so just really talking about those kinds of things. And, especially trying to reach community, like minority communities. Those are what experts say. Those communities seem to be communities that really have a lot of the most concerns.
Yeah, very susceptible. For whatever reason, something is still being looked into. Larissa, I cannot thank you enough for your time after another long day, long morning, I guess, is what we call it. Long morning into afternoon feels like forever sometimes. Thank you again. And again, you can see Larissa Scott's reports every single morning on Good Morning Tampa Bay. She is a hyper-focus recently on the vaccine distribution, and you heard what she's going to be doing in the future, and we're looking forward to seeing those. The Rebound Tampa Bay podcast is available to listen to and download on Apple, Stitcher, and Spotify. We put video versions up all over the place on the ABC Action News app, our streaming news channel, which is an app on a device like a Roku or Apple TV, and also on my Facebook page, James Tully WFTS. I post the video version there that you can check out, listen to, and watch on your way to work. New episodes drop every single Wednesday morning. Thank you for listening.